Hello and welcome to Dantashastra, where knowledge meets clinical wisdom. Today, let's look into the extraoral and intraoral examination. I'll discuss about the sequence that I follow during my OP checkup, which ensures me to diagnose and plan the treatment properly. I first start with extraoral examination. I look for any swellings if present, and if there are any swellings, I look for the region of swelling, extent of swelling, tenderness to palpation, and finally any opening or discharge. Once the examination of swelling is done, I look for any facial asymmetries, and after all this is done, I go into the intraoral examination. In the intraoral examination, I first take a look at the region that the patient is complaining of. After that, I go quadrant wise to finish my intraoral examination. While doing so, the first thing that I would always look for is the missing teeth. And then I look for any grossly decayed teeth or the root stumps that are not restorable. And then I look for the carious teeth that are restorable. And then comes the calculus and stains. After that, I look for the soft tissue swellings or any soft tissue lesions. And then I look at the gingival architecture. And then I go into looking for crowding, spacing, or any rotations in the teeth. And then I look for the pockets, and then I go into the non-carious lesions like abrasions, abfractions, erosions, and all those. And then I look for the impacted teeth, and in the end, I always end up my checkup by checking the occlusion, the molar relation. By following this sequence, I can be sure that I've covered all the aspects of the oral cavity, and it hardly takes 5 minutes to do this. But this 5 minutes will give me the whole picture of the patient's conditions. In the next video, let us see what are the common signs and symptoms that we encounter in a daily clinical practice. If you have any suggestions or you want me to discuss any particular topic, please let me know in the comments. Do like, share, and subscribe, and thank you for your support.